Residents in the new U.S. epicenter of the coronavirus outbreak deal with a new reality: quiet streets and stressful times. New York, much of the city that never sleeps, is unusually quiet. But for many of the 8.5 million people who live here, the coronavirus pandemic is taking a heavy toll on their health, security, and everyday life. New York City has become the new epicenter of the coronavirus pandemic in the United States, with more than 25,000 confirmed cases of COVID-19 and over 300 deaths as of Friday morning. America's largest and densest city accounts for more than 4% of confirmed cases of the coronavirus worldwide. For some residents, the new reality means managing a dizzying stream of updates from friends, relatives, news media, and city and state leaders. Others are grappling with job losses and new daily challenges as all but essential businesses have shut down and a stay-at-home order took effect on March 22. New York City's 1,800-plus public schools were officially closed on March 15, so the more than 1 million students they serve, plus their teachers and parents, are adjusting to remote instruction until at least late April. Coronavirus in NYC causes uncertainty. A young man with flowers waits for the subway at the Times Square 42nd Street station as New Yorkers deal with the spread of the coronavirus in Manhattan, NY on March 13, 2020. View all 22 images. Hospitals across the 5 boroughs are seeing a surge of patients, which is expected to intensify in the coming days and weeks. I've never felt so physically and emotionally burdened in my life. I've never felt so deeply sad and distraught, an emergency medicine physician who works at several city hospitals told the Associated Press this week. It's not just the hospitals. The impact of the pandemic has put an enormous strain on a system that was already strained, says Sheena Wright, president and CEO of United Way of New York City. The nonprofit group supports about 600 community organizations across the city that work to help millions of New Yorkers in need deal with food insecurity, financial stability, education, and other challenges. With so many out of work and students suddenly out of the classroom, the demand for the services that we help provide went through the roof, Wright says. For example, the UWNYC is the backbone of the Emergency Food Network, Wright says, which means supporting food pantries and kitchens across the city. Those places have seen surging demand from residents, but with the stay-at-home order also a reduction in volunteers who staff those facilities. On Wednesday, the UWNYC announced a COVID-19 community fund to provide resources for its citywide network, supported by donors like the New York Jets and National Grid. Wright says the money will allow her and her staff to help people meet immediate needs, get food on the table, as well as anticipate what's to come in the months ahead, such as supporting students and families during summer school or ensuring the success of the census, which will be critical for determining how resources are allocated in the long term. The truth is that this is not a sprint, this is a marathon. We always said this is not going to be over quickly. I understand people are tired, but I also understand that people in this situation are really stepping up to the plate and are doing phenomenal work, New York Gov. Andrew Cuomo said during a press conference on Thursday. The governor's daily news conferences have become appointment viewing for those who are hungry for updates and a sobering reality check of what to expect. He often shares updates on the ongoing efforts to set up temporary hospitals around the city and state. Around the city, other spaces are transforming or emptying out. As the stock market has seen wild swings over the course of the last several weeks, the New York Stock Exchange trading floor on Wall Street has closed until further notice, with trading continuing electronically to reduce congestion. Times Square, often overflowing with visitors, is quiet. The Broadway shows there have shuttered until at least mid-April. And just like so many industries across the nation, the economic impact will be severe. Those theaters drew more than 14 million attendees and over $1.7 billion in gross revenue in 2019, according to the Broadway League, an industry trade association. The ultimate fear is that when we emerge from our caves that everything we love about New York is gone, says Vanessa Haddox, who works in the arts and cultural sector. She has been working from her home in Brooklyn since March 11, adjusting along with her colleagues to hosting virtual poetry readings and arts classes. So far they have been pretty successful, Haddock says, and have helped ease the burden of an industry that relies on in-person gatherings. This is the impetus for us to figure out how to do that. Personal and professional lives are colliding in unexpected ways as those who are working from home juggle spouses, kids, roommates and technical difficulties. For grocery store cashiers, delivery workers and other essential workers who are still working but cannot do so from home, the need for things like childcare are even more acute. Jamie Jin Lewis runs a rapid response program to find low-cost childcare for essential workers and sees this firsthand. There's no centralized database of childcare resources that are available now, Lewis says. We are working with parents to really try to do some of the research for them. She and her volunteers are exploring what resources are out there and then sharing those insights with working parents to save them time and money. For Lewis, who has lived in New York since 2009 and worked in a number of roles in the nonprofit and philanthropy sectors, the effort is also helping keep her connected to the city. With working from home and social distancing, you feel how small your world can get so quickly, Lewis says. I actually think people are reaching out and touching people virtually in a way that is unprecedented, says Tony Marks, president of the New York Public Library. The system, which has about 90 facilities across 3 boroughs, has seen an almost 7-fold increase in new users for its online offerings and about a 50% increase in checkouts of books, Marks says. Even as many are turning inside, pedestrians, parents pushing strollers and occasional joggers are still out, and many of them, though not all, seem to be trying to keep their distance from each other. A number of passers-by are wearing masks and gloves around, whether to pick up food or groceries or get fresh air. It's still possible to go out for a walk, being respectful of everyone's distance, says Chris Walzer, a wildlife veterinarian and executive director of health at the Wildlife Conservation Society. The organization operates the New York Aquarium and 4 zoos across the city, all closed, as well as a range of science, health and education programs around the world. Many of our activities, of course, have slowed down in the field around the globe, Walzer says. But I've probably never had as much work as I've had now, he says, particularly as he examines the impact of coronavirus worldwide. The often bustling East Village is a patchwork of quiet restaurants, bars and coffee shops that have either closed or are only offering takeout or delivery for now. Certain places are offering food discounts for medical workers or are requesting donations to keep their staffs solvent. Normally ubiquitous cabs are few and far between. New York City Police Department officers have been patrolling some areas and encouraging social distancing. The Metropolitan Transit Authority announced that subway service has been reduced as ridership has plunged. It was down by more than 80% earlier this week compared to the same day in 2019. The subway typically sees more than 5 million riders on the average weekday. Mayor Bill de Blasio and city officials have said that certain city streets will close to give pedestrians more space to move around than on the typically congested sidewalks. The city is working to limit public gatherings on playgrounds, parks and basketball courts around the 5 boroughs. It's a fair bet to say that half of all New Yorkers, and maybe more than half, will end up contracting this disease, de Blasio said Wednesday. And that's worrisome, very deeply worrisome, for all of us, but we have to start with the truth. What comes next is uncertain, but New Yorkers are taking it day by day. My first day on the job was Hurricane Sandy, says Wright of the UW-NYC, who saw the city navigate the recovery from the superstorm that hit hard in 2012. Wright, who grew up in the Bronx and currently lives in Harlem, is concerned about the lasting effects of the coronavirus. The number of our small businesses that are closed, she says. I'm so worried about their ability to come back and rebound.